Let's dive in and talk about some of the most popular peptides out there, some of which you've probably heard of, and there are many others. These are just my top picks based on my own clinical practice and what I've seen most in the data from peptide conferences over the years and in the advanced certification. On peptides, I am currently doing with the A4M, which is the American Academy of Anti-Aging Medicine, a really legit and wonderful source for peptide know-how and teachers. I really love the A4M. I've been to their peptide conferences, so if you want to take that on without spending thousands of dollars on a course like I did, that's a good way to sort of like get into the space, see who's talking about what. It's pretty fun and amazing little worlds. So for your average person, I think about peptides in a few buckets, and there are others that are more niche or disease focused, but I'll keep it broad today. The first bucket is the repair and recovery peptides. Let's start with the one you've probably heard about online. I've already mentioned it 5 times, BPC-157. It's probably the most popular one after the GLP-1s, especially in athletic and training circles. BPC stands for Body Protection Compound, and it's among the longest studied peptides and one of the earliest. So it was originally identified and developed by a Cold War scientist in Russia named Vladimir Kavinsin. He is hailed somewhat as the godfather of peptides and a brilliant scientist. He actually just died recently, sad face. But at the time, he was trying to create super soldiers who would heal really quickly from their war wounds. And in fact, he succeeded. So your gastric juice, the gunk your stomach produces when you're like digesting, it naturally makes a BPC-like peptide to protect and repair your gut lining, which takes constant mechanical and chemical stress and damage from food. This is kind of cool fun fact side thing. When you're young, you have tons of BPC-157 in your tum-tum. In fact, babies make a load of this stuff to heal their little guts as they transition from liquid food to solids. BPC-157 is there to support. So in plain language, what does BPC-157 do? It seems to help repair the gut lining. So thinking ulcers, gastritis, an irritated gut from NSAIDs or stress or any of the inflammatory conditions that people tend to suffer. It supports tendon, ligament, and muscle healing in injury or wound healing models and in humans. It calms inflammation and even shows some neuroprotective effects in animal studies. So in practice, people tend to use it orally when the main target is gut healing. BPC-157 is unusual because it's made in the gut and can survive the gut, the acidity, the enzymes, so it can be taken orally. And this is particularly helpful for gut conditions. If the goal is more targeted to injury or wound repair, surgery, or an athletic situation, it is taken by tiny subcutaneous injections, ideally close to the site of injury. It does work a little bit better when localized to the area. Injected, it has broader, more systemic effects on all your tissues, including those tendons, ligaments, and possibly the nervous system based on animal models. It's an absolute all-star in the world of athletics and recovery. And conjecture has that, this is clinical observation, things I've heard in conferences, that it speeds healing by roughly 2-fold. Wow, right? Amazing. It also helps the day-to-day athlete, myself included, to recover and build muscle more quickly. I observe in myself and many of my clients, holy moly, did my mountain biking and ski touring and running capacity take a huge leap when I started these peptides. And in fact, BPC-157 and its wonderful partner, TB-500, which we'll talk about next, are so effective in giving an athletic edge that they're actually banned in professional sports. So just please be aware of that if you're a competitive athlete. BPC-157 is also a major fan fave in the longevity space. So many doctors I know, longevity experts, other providers take it regularly or do several cycles of it. among other peptides on a yearly basis. So this is one of the all-time favorites among my heroes in the space. It's one I keep around all the time as well, just in case. Anyway, it is not FDA approved yet. We don't have giant clinical trials in humans yet, but it is widely used in the regenerative space and has been for decades and is considered very safe when sourced properly. It is one of the ones where you can take 1,000 times the dose, and people have, and nothing bad will happen. So cool. Okay, so number 2 in this sort of tissue repair bucket is the immune modulating thymic peptide. So now there's 2 I'm going to talk about. One is more about tissue repair and one is about the immune system. So when you're a child, you have this big thymus gland in your chest. It's the source of your immune system. It educates your immune system. Around puberty, it starts to shrivel, or what's technically called involute. So involution of the gland, shrinkage. So by the time you're older, maybe by the time you're in your 60s, it's actually almost gone. It's mostly fat. And that's one of the reasons that autoimmunity and cancer risk rise with age. And so there's 2 key thymic peptides I want to talk about today, which are thymosin beta-4 and thymosin alpha-1. The beta-4 fragment I want to talk about is TB-500, but there are a whole bunch of them. So TB-500 is known as the anti-fibrotic or messy scar tissue and repair helper. Helps tissues repair beautifully and with less disorganized collagen fragments, which is where you get those gnarly scars. Thymosin beta-4 is a 43 amino acid peptide, a bit of a longer one that your body makes in many tissues, including the thymus. And then TB-500 is a short 17 amino acid fragment of that peptide that seems to carry a lot of the tissue repair punch. And these peptides help cells to move, migrate around the body, lay down new blood vessels, so that's angiogenesis, and remodel tissue. They speed wound healing, reduce fibrosis and scarring after things like heart attacks or lung injuries. They support healing in tendons, ligaments, fascia, and other connective tissues, and so on. Clinically, it's often paired with BPC-157 when we're trying to heal an injury or even heal an old injury better. That's one of the cool things, is that people who have, like, say, knee pain since 20 years and they had a surgery, we can come in and use these things to remodel that tissue. To some degree, sometimes it works well, sometimes it doesn't work as well. We can also use them to reduce the amount of stiff scar tissue that forms after surgery or significant inflammation, as I alluded to before. Again, not an FDA-approved drug in the US, but conceptually you can think of BPC-157 and TB-500 as a synergistic repair duo. Okay, let's now talk about the other thymus peptide, thymosin alpha-1, which is about the immune system. This is a 28 amino acid peptide that in many countries is an actual drug used widely and effectively called Zadaxin. It's incredible, and it's been used for over 20 years in people with chronic infections, cancer, and immune problems of all kinds. It's truly a remarkable multifunctional peptide that I dearly hope is next to hit the market here because it's so impactful for people who are really suffering. Thymosin alpha-1, what does it do? It helps your immune system sort of behave in a healthy way. It shifts your immune balance, actually, and this is important for older people, so I'm going to talk about this bit first. It shifts your immune balance towards more youthful, healthy, effective Th1, so-called, and Treg activity. And that part fights viruses and cancer, for example, and shifts it away from Th2 activity. And this is important for us because as we move through perimenopause and menopause, or manopause, if you will, as a man, and our hormones like progesterone and estrogen start to fall, our immune system often becomes a little imbalanced, or maybe very imbalanced, shifting to be more what's called Th2 dominant. This means that the hormone signals that used to keep inflammation and antibody responses in balances are in decline. So we'll often see more background inflammation, slightly weaker infection defense, and higher risk of things like autoimmunity, flares, allergies, food sensitivities, joint, gut, or skin symptoms. Like, these things come up all the time. So in practical terms, many women notice that in midlife and beyond, they just don't bounce back from stress or poor sleep or a unhealthy meal or infections as quickly. And they may develop new sensitivities or autoimmune issues because their immune system is going through this normal transition that we can support with targeted lifestyle, nutrients, hormones, and peptides where appropriate. In a more functional medicine clinical setting, though, we would think about Thymosin Alpha-1 for people who catch every virus. They have a poor immune system. They have chronic viral loads, things like herpes, hepatitis, long COVID, Lyme, mold, any of that kind of stuff. They have immune system dysregulation or autoimmunity, and they need better sort of immune intelligence rather than simple broadband drug-based suppression. To summarize so far, BPC-157 and TB-500 are about physical repair. Thymosin Alpha-1 is more about immune repair and balance, helping your defense system act more like it did when your thymus was young and big and busy. And together, all three of these are super powerful. And so these three are very big in longevity.